Cholangiocarcinoma is a lesser-known primary liver cancer that is often missed, misdiagnosed, and managed too late. A new analysis of NHS records reveals that 2 in 3 patients do not receive any form of cancer treatment. We need more awareness to shape a better future for people affected by this cancer.
I met my husband Jonathan through a newspaper Lonely Hearts advert. It was funny, clever, endlessly curious, and full of energy. He loved running, was always training, and worked as a consultant in the NHS. When he started having stomach pain and constant burping, he brushed it off. He put it down to indigestion, his diet, maybe too much coffee. None of us imagined it could be cancer. I still beat myself up for not pushing him to get checked sooner. By the time Jonathan was diagnosed with cholangiocarcinoma, his doctor said it had likely been there for over a year and had spread everywhere. Even as a doctor, this cancer was hard to recognize. It isn't well known, and its symptoms are easy to miss. In just 3 weeks, I went from telling our sons, aged 3 and 6, that their dad was ill, to telling them he had died. Jonathan was only 59. Our story shows why awareness matters. We need greater public understanding, clearer guidance for doctors, and early investigations of symptoms so that fewer families are left with questions that come too late.
Even in people suspected of having cholangiocarcinoma, it can be difficult to diagnose due to the location of the tumour. That's why we need the NHS to introduce new ways to detect and diagnose this cancer earlier.
It took 1.5 years for doctors to diagnose my cancer after I first went to the GP with my symptoms. I felt sick all the time and constantly exhausted. I had just got married and had a lot going on at work, so I assumed it was stress. Then my skin started to itch. It was unbearable. I couldn't sleep. I questioned everything, the weather, my diet, anything but cancer. Scans showed I had a liver condition called primary sclerosing cholangitis. Looking back, my consultant is fairly sure the cancer was already there. It simply wasn't detected because it was at such an early stage. What followed was months of uncertainty. Is it cancer? No, it isn't. We'll test again. Now it is. During that time, a lesion developed on my liver. That lesion was cholangiocarcinoma. I spent months in hospital, away from my new husband and my family. I caught infections, including COVID, and endured repeated invasive procedures. 1 year on from my diagnosis, and I'm doing well. But my story shows why earlier and better diagnostic testing is essential. We urgently need improved tools to detect cholangiocarcinoma sooner, so fewer people are left waiting whilst this cancer grows silently.
Innovative new therapies for cholangiocarcinoma are changing how the disease is treated and extending lives. But for everyone to benefit, all patients need to be assessed by an NHS specialist team with expertise in this cancer.
When I was diagnosed with cholangiocarcinoma, I turned to Google to understand a cancer I'd never heard of and was met with terrifying statistics. Would I see my 3 children grow up? I asked my doctor. His face said everything. My future looked grim. I pinned my hopes on surgery, but was told my cancer was inoperable. I wasn't prepared to accept that. With AMMF support, I sought a second opinion from a specialist and transferred my care to a centre of expertise in London. 3 years on, and after chemotherapy, radiotherapy, and plenty of setbacks, molecular testing identified the mutation driving my cancer and an immunotherapy that could target it. I don't resent how long it took to find the right treatment. In many ways, it's a miracle I survived long enough for it to be found. But my story carries a message to our health service. Support patients to access specialist care early and act on molecular and genetic testing from the start. And if you're facing this diagnosis, ask questions, seek other opinions, and hold on to hope.